Okay, I've been tasked to lecture on how we formulate the research question. So, good day, everybody. Today, we will discuss one of the most important steps in the research process, formulating the research question. Many students focus heavily on methodology, statistics, and data analysis, but experienced researchers know that the quality of a study often depends on the quality of the research question. A well formulated research question serves as the foundation of the entire study. If the question is unclear, the study design, data collection, analysis, and conclusions will also be unclear. By the end of this session, you should be able to develop focused, feasible, and answerable research questions suitable for academic and professional research. At the end of this lecture, you should be able to first define what a research question is, explain why it is important in the research process, distinguish between strong and weak research questions, use the frameworks such as Finer and PICO to formulate your questions, and finally, create your own research question for a potential study. These skills are essential whether you are conducting undergraduate research, postgraduate studies, or future clinical and public health investigations. Let us begin with a definition. A research question is a clear, focused, and answerable question that the study seeks to answer. Think of it as the central inquiry that guides every aspect of the research process. Without a research question, research lacks direction. For example, if someone says, I want to study diabetes, that is not yet a research question. It is merely a topic. A research question transforms a broad topic into a specific inquiry that can be systematically investigated. The research question helps determine what information is needed, who should be studied, what methods should be used, how results should be analyzed. In simple terms, the research question is the compass of your research journey. Why should we spend so much time developing a research question? Because the research question provides direction. It determines the study design, the target population, the variables to be measured, the statistical methods to be used. A poorly formulated question can result in unfocused literature reviews, inappropriate methodologies, difficulty obtaining meaningful results. Remember the saying, a problem well stated is a problem half solved. A clear research question makes the rest of the research process significantly easier. Let's examine where the research question fits into the overall process. Research typically begins with observing a problem. For example, a physician may notice poor treatment adherence among patients with hypertension. The researcher then reviews existing literature reviews to determine what is already known. After identifying gaps in knowledge, a research question is formulated. Only after developing the research question can the researcher establish objectives, formulate hypotheses, choose a study design, collect data, and conduct analysis. Notice that the research question serves as the bridge between identifying a problem and selecting a methodology. Where do research questions come from? Research questions often emerge from everyday experiences and observations. One source is clinical practice. For example, a physician may wonder whether telemedicine is as effective as face to face consultations. Another source is public health challenges, such as increasing rates of obesity or vaccine hesitancy. Research questions can also arise from gaps in the literature. Perhaps previous studies have produced conflicting findings or certain populations have not been studied. Policy concerns can generate research questions as well. Researchers may want to evaluate whether a government health program is achieving its intended outcomes. And finally, personal interests and professional experience often stimulate valuable research ideas. A common mistake among students is confusing a topic with a research question. Consider the topic diabetes. This is far too broad. A narrower topic might be diabetes management among elderly patients. While better, it still lacks specificity. Now consider this research question. Does participation in a diabetes education program improve glycemic control among elderly patients with type 2 diabetes in Metro Manila? This question identifies a population, an intervention, an outcome, and the setting. This is the level of specificity needed for a research study. A strong research question possesses several characteristics. First, it should be clear. Readers should immediately understand what is being asked. Second, it should be focused. Avoid trying to answer too many questions simultaneously. Third, it should be researchable. The question must be answerable through scientific investigation and data collection. Fourth, it should be feasible. The study should be possible given available resources, time, expertise, and funding. Fifth, it should be relevant. The findings should contribute to knowledge, practice, or policy. And finally, it must be ethical. The researcher should never place participants at unnecessary risk. Let us review some common mistakes. One mistake is asking questions that are too broad. For example, what causes cancer? Cancer has thousands of causes and mechanisms. This question is too extensive for a single study. Another mistake is asking questions that are too narrow. For example, what was the blood glucose level of one patient at 8:15 a.m. yesterday? This question lacks broader significance. Questions may also be too vague. For example, why are patients unhappy? Unhappy about what? Waiting times, costs, communication? Why are they unhappy? So finally, avoid leading questions. For example, why is telemedicine better than traditional consultation? This assumes that telemedicine is better before evidence is collected. Research questions must always remain neutral. A useful framework for evaluating research questions is the FINER criteria. FINER stands for feasible, interesting, novel, ethical, relevant. A strong research question should satisfy all five criteria. Think of FINER as a quality control checklist before starting your study. So this is an example of applying FINER to a sample question. Does telemedicine improve patient satisfaction among hypertensive patients in rural communities? Is it feasible? Yes. Patient satisfaction can be measured using surveys. Is it interesting? Yes, especially as telemedicine continues to expand in the modern times. Is it novel? Potentially, depending on existing evidence in the local setting. Is it ethical? Yes. Is it relevant? Certainly, because healthcare systems increasingly rely on digital services. Therefore, this question satisfies the FINER criteria. Developing a research question is a stepwise process. First, identify a broad topic, for example, mental health. Second, review the literature. Third, narrow the topic, perhaps focus on medical students. Fourth, identify specific variables, for example, steep quality in academic performance. And finally, formulate the question. This systematic approach prevents researchers from selecting questions that are either too broad or too vague. Several frameworks help researchers formulate effective questions. The most common are PICO for clinical and quantitative studies, PICOT for clinical studies involving a specific time frame, PEO for qualitative studies, SPIDER for qualitative and mixed methods research. These frameworks provide structure and ensure important elements are included. Okay. PICO stands for Population Intervention Comparison Outcome. This framework is widely used in evidence-based medicine and clinical research. When developing a clinical question, identify each of these components. Doing so helps create a focused and answerable question. PICO example, consider adults with hypertension. The intervention is telemedicine follow-up. The comparison is standard clinic visits. The outcome is blood pressure control. Combining these components produces a clear research question. Among adults with hypertension, does telemedicine follow-up improve blood pressure control compared with standard clinic visits? Notice how the question becomes precise and measurable. PICOT simply adds a time component. So for example, among adults with hypertension, does telemedicine follow-up improve blood pressure control compared with the standard care over 6 months? 6 months is your time element. Adding time improves specificity and assists with study planning. The PEO framework. For qualitative research, we often use PEO. P stands for population, E for exposure, and O for outcome or experience. For example, what are the lived experiences of nurses providing frontline care during the COVID-19 pandemic? This type of question seeks to understand rather than to measure. Research questions can be categorized according to purpose. Descriptive questions ask what is happening. Analytical questions ask why something is happening. Comparative questions compare interventions or groups. Predictive questions identify factors associated with future outcomes. Exploratory questions investigate experiences and perceptions. Understanding the type of question helps determine the appropriate methodology. For descriptive research, what is the prevalence of obesity among adolescents in Manila? For analytical research, is obesity associated with physical inactivity among adolescents? For experimental research, does a school-based exercise program reduce obesity rates? For qualitative research, how do adolescents perceive barriers to physical activity? Each question requires a different study design. Let's look at an example. Suppose a hospital reports high burnout rates among nurses. After reviewing literature, you discover limited Philippine evidence regarding factors associated with burnout. This leads to a focused question. What factors are associated with burnout among nurses in tertiary hospitals in Metro Manila? This demonstrates how researchers move from a practical problem to a researchable question. Compare these examples. Does exercise help? Help with what? For whom? The improved question is among adults aged 40 to 60 years old with hypertension. Does participation in a structured exercise program reduce systolic blood pressure compared with usual care after 12 weeks? Specificity improves research quality. Okay, for this particular example, what do patients think? Think about what? The improved question should be, how do patients with chronic kidney disease experience barriers to treatment adherence? The revised question clearly identifies the population and phenomenon of interest. Before finalizing your question, ask yourself, is it clear? Is it focused? Is it feasible? Is it significant? Is it ethical? And can it be answered using data? If you can answer yes to all of these questions, you likely have a strong research question. Okay, let us summarize. A good research is clear, focused, researchable, feasible, ethical, relevant. Use Finer to evaluate the quality of your research. Use PICO, PICOT, or PEO frameworks to structure your question. And always remember, the success of a research project often depends on the quality of the question that starts it. A strong study begins with a strong research question. Thank you for your attention. As you begin your own research projects, spend sufficient time refining your research question. Many researchers say that once the research question is properly formulated, the rest of the study tends to fall into place. In research, as in life, well begun is half done. Questions and discussions are welcome. Thank you.